Now, talking about the CWIS framework, I'll not talk much about this particular set of the service outcomes and the system functions, because I think it's been long. And then the session, I mean, like in most of the sessions, you have covered about equity, safety, sustainability, responsibility, accountability, and resource management. So I'll not talk about this in much more detail. But then just to give a different perspective, right? I mean, like we have talked about CWIS. Now, is it a completely new approach, right? Or is it something which we already have in place, but then it's just a new way of looking at things? Like, let's talk about the NUSP that we have, right? I mean, like the NUSP's vision statement is like all Indian cities and towns should become totally sanitized, healthy, livable, and ensure and sustain good public health, environmental outcomes for all the citizens, with a special focus on hygienic, affordable sanitation facilities for the urban poor and women. Now, this particular statement has all the features in it, right? I mean, like all the CVs features that we talked about, and this was like long back done. So it talks about equity, right? I mean, like it talks about that everyone, including the urban poor communities, informal settlements, people who have lack of tenure facilities, space or economic constraints. So it does look into it has that inclusive feature into it, and it talks about equity and definitely yes about safety in terms of safe sanitation. It also talks about sustainability, like the technical solutions that we are looking at should be financially sustainable. It does talk about responsibility. We do have clearly set out responsibility roles and responsibilities, and the mandate is very clear that the ULBs are supposed to be delivering all the sanitation related activities. They should respond to the they are accountable to the states, and the states should be there to support the ULBs. And then accountability, right, as well. So the state governments are responsible for monitoring a city's performance. And then we also talk about, so the NUSP does talk about resource planning and management. This is not only in NUSP. If you look at the Andhra Pradesh Municipality Act of 1965, if you look at the Telangana Municipality Act of 2019, so these components of CVIS components, right? So these are all present in our policies, and this is something that is not very new. It's just a different way of looking at it, and I'll come to why are we looking at it a bit differently. So let's like this is a study which was done in 2019, and so the annual investment according to the study was this World Bank study that was there. So it says that across approximately $120 billion is required for an annual investment to reach SDG 6, and this has been done across 10 countries. However, if we look at that, and so the annual subsidy that is given from the government for sanitation related activities was 290 billion. So if you see that 120 was required, whereas the annual subsidy that was given was much higher than what was required. Now, the interesting thing is 56% of this 290 billion was allocated towards the wealthiest 20% of the population. However, only 6% of the subsidy went to the poorest 20% of the population. So like you can see like that the existing subsidies are more than sufficient to cater to your or reach or help cities reach the SDG 6, but then are highly inequitable in the way it is distributed, right? And so the language, so that brings me to my point, right? The language is there. However, the goals are not translated into the shift in practice or the mindsets and the outcomes, the kind of the way we are performing our activities or the way we are measuring our activities. And that is where I think the CVIS monitoring framework is very useful. So this is this. So like we look at the equity, we look at safety, we look at sustainability across I'll not go into the details of the indicators per se, but just to give you a flavor of how the indicators look like. And this is a set of primary indicators. I have already shared the list of detailed indicators with the ASCII team, and I think they will share it with all of you as well. But just to give you a few examples of the indicators, like let's talk about the safety related indicators, right? There's one indicator which talks about the percentage of collected FS that is disposed at the treatment plant or designated disposal sites. Now, going back to the first slide, we had this data and then we had the sources, right? So we talk about the volume of collected FS that is disposed at the treatment plant or designated disposal site. So this is the data that you are capturing from the FSTP logbooks. If you have a treatment plant, so then what is the data that you're collecting from the logbook. And the second thing is what is the total volume of FS that is collected. And again, so like you are looking at this particular data from the survey data or estimation using the containment units data method, or the number of the number of septic tanks, the number of pits and their volume. So you understand that what is the total volume of FS that is collected. So these are the indicators that is mentioned over here in the below, and for each indicator you would have like data points which would look at the whether the data points which can be used to estimate or calculate that particular data. Now there are a lot of quantitative indicators under safety. So safety is very easy, like in terms of the percentage population, like talking about few of the examples, like the percentage population with access to improved individual toilets, the number of septic tanks that have been desludged within the city's recommended time frame. You would want to understand that, okay, if my city is have to be safely managing the fecal sludge that generated, then what is the number of septic tanks which is being emptied once every 3 years, as is recommended by our national the CPHO guidelines. If you're talking about the percentage of desludging services completed, how many of them are completed mechanically as compared to how many of them are completed semi-mechanically. So these are some of the examples of the safety related indicators. Now let's talk about equity. So I mean, like, equity has not been so much comprehensively talked about or covered in the national data sets that we have. And also because there are set of indicators which are a lot of looking at, like, let's talk about sanitation workers equity from the equity perspective. Now we know that there are a lot of sanitation workers, so the data that we will be looking at and their safety is very important. So the data that we'll be looking at is the percentage of sanitation workers that are covered by a social security or a health insurance. Then whether there are worker unions present or not, which can give a voice to the sanitation workers. Talking about presence of formal channels for which either privately contracted sanitation workers or the government sanitation workers, they have a channel to, if there is any channel for them to register a complaint or not for their employment formality. Talking about the sources, it can come from secondary sources in terms of data reports, government schemes records, the National Safai Karmachari's records. It can come from primary data, interviews with key stakeholders. So it's a combination. The set of indicators which are mentioned over here is a combination of all quantitative as well as qualitative indicators. So again, then talking about, like, there can be other indicators which is talking about the number of percentage of women in sanitation related decision making bodies. So you look at the organogram to understand whether it's the positions that is filled by your municipality is there gender in gender balance in that particular filling of the positions or not. Then talking about safely looking at percentage of LIC population with access to safe individual toilets. So like looking at whether the lower income communities population, they have access to safe toilets or not. The population that is staying in the slum areas, or the be it a designated slum or be it a recognized notified slum. So these are a set of indicators under equity, safety, and then yes, sustainability. We are looking at whether the kind of treated fecal sludge that is there or the wastewater that is there, how much of the treated wastewater and the treated fecal sludge is reused. Also looking at from the cost perspective, whether the operational cost is completely recovered or not, the operational cost for your wastewater treatment plant or for your fecal sludge treatment plant. Also looking at the percentage capital investments that you are making, how much of it is covered through a budget line transfer from the state or the central government, and how much of it is not covered by that. So these are the set of indicators that will look at equity, safety, and sustainability for your services to be more equitable, safe, and sustainable. There is a set of indicators which are looking at the responsibility, accountability, and resource planning. So the responsibility is very clear, like whether there is a policy document or not, which makes it very clear that whether the mandate is clear and inclusive. There is a mandate which has no exclusion to whether it's a poor or whether it's explicitly pro-poor or not, whether it's gender intentional or not, whether it's inclusive of vulnerable groups or not, providing services, additional services to the vulnerable groups or not. Talking about accountability, like authorities like ULBs operate with clear KPIs. Do you have performance targets in place where you can respond that, okay, yes, 30% of my households have earlier last year they had access to safe toilets, and that has increased from 30% to like 50%. And I have a performance target of like I have to achieve 80% or 100% by the end of 2025. So having set clearly defined performance targets in place, again giving an example over here, so these are very much qualitative in nature. So talking about resource planning and management, that whether the staffs in play are in place or not and are capable to execute and the mandate that is given to them. So you would want to understand how many of the sufficient positions exist. Looking at an organogram, right? I mean, like there is a prescribed organogram for every municipality, and you would want to understand out of that organogram how many positions, whether that organogram is sufficient for me to deliver my services to the city or not. And again, then whether there is the staffs and contracted people are there in place to fill out those positions that is defined in that organogram. Again, like looking at periodic training, I mean, like looking at staffs are in place or not and capable to execute mandate, you would also need to understand whether there are staffs are getting periodic trainings or not, and whether there's capacity building sessions which is happening or not. Again, like this kind of data you would get from having primary data, like data points, having interviews with key stakeholders, looking at training documents, looking at the organizational structure, or the organogram. So yeah, these are the kind of indicators that we have. I will not go into the details of it, because if I go to explain all of the indicators, it will take I can talk about half an hour per indicator. So